One. Welcome, everybody, all you powerhouse partners out there, for all the different IMOs that are with us, strategic partners. Welcome to you guys as well. We're really excited today about this call. Over the past few weeks, the team has been growing crazy. Definitely different strategic partners. You guys are doing a great job in building your organizations as well. And we're excited here to provide the whole platform to do Medicare Advantage as well as ACA Obamacare. Now, today, I wanted to take today's call. It's probably going to be a quicker call. I'm not going to go probably 20 minutes more than that. But I want to go deep into compensation, right? The first thing I want to make sure that everybody understands is that there's basically two sides of the house here. The first side, which is what everybody really is really big on and is faster, is the Obamacare side, right? It's the ACA side. ACA grows fast because you only need to have your health license in your state, and you need to do your FFM, right, which is a federally facilitated marketplace certification. Now, if you live in one of the states that has a state system like New Jersey, Arizona, California, you're going to have to do that one as well, okay? But once you do the certification for that, you're pretty much off to the races, get contracted and get going with all the different carriers, right? So that's why the Obamacare one really grows faster. Also, we're going to talk today a lot about PMPM, per member per month. And in the ACA side, when you walk into a family, the whole family is, each member of the family is getting you paid, right? So that's pretty cool when it comes to the growing of your business, right? And growing of your paycheck, right? We got one guy on our team, the top income earner right now on our team, makes $27,000 a month, right? Which is not bad money, right? Not bad money, not a bad problem to have, right? And we have a lot of people in their first few months, are able to upgrade their car, upgrade their house, right? The income grows pretty fast, right? So without further ado, I am going to ask everybody to have pen and paper with you, because I'm going to I'm going to tell you some stuff, but I also want you to have you to write it in your pen and in your what they call puño y letra in Spanish, right? Because that way you understand the way that this works in your handwriting, right? So I'm going to go ahead and share my screen here. Where is my share screen button? Sorry about that, guys. Here we go. All right, at this point, you should be seeing a Powerhouse Partners sign. Does everybody see Powerhouse Partners here? Give me a thumbs up. All right, good deal. So I'm going to go ahead and do this presentation like cat quick, but I just want to go into it because I think this one explains it the best, and then I'll go into detail of the different plans and stuff like that. But basically, we started this company to work with different IMOs, different agencies, make sure that everybody has an opportunity to participate in health insurance, being both ACA and Medicare, right? What I fell in love with was the fact that this is the only way that I know that you can get off your income roller coaster life. You guys got highs and lows, right? You guys, especially if you sell real estate, if you sell regular life insurance, you'll have good months, you'll have bad months, right? With what I'm going to show you today, as you build your book of business, your monthly residual income should go up and up and up and up, especially if you're working every single month, right? And adding new clients to your book of business. The ACA side, I'll tell you guys, we really got heavy last year after this ruling, right? In Texas in 2018, for the third time, the law, Affordable Care Act, or also known as Obamacare, was challenged in the United States Supreme Court. The third time it was challenged, right? And on this third time, a 7-2 conservative court, let me get to that part, a 7-2 conservative court upheld the law. And I'm not here to talk politics. I'm just here to tell you guys the truth, right? If you look at the 7-2 conservative court upholding this law, there's no liberal court in the history of this country that's going to debunk Obama's legacy. So it is the law of the land, guys. It is here to stay. You can build your business. You can sink your teeth into it, because for the first time in a long time that I know of, the conservatives and the liberals are both together with this, right? everybody needs and deserves universal health care. So now let's build, right? The pioneers, and there's a lot of pioneers in this business, a lot of people making good money, right? But the time to start building it is now, right? So you guys that are here are able to start building it. So AKA Obamacare, right? ACA, everybody qualifies. There used to be, pre-existing condition. If you had diabetes, heart attack, heart condition, and now everybody qualifies. It's 0 to 64 years old for sure qualifies. And those, okay, I got somebody with some noise. If you could, everybody mute out. And those that are above 65 that don't qualify for Medicare, qualify for ACA, right? So everybody qualifies for ACA, which is good because you, as a salesperson, now have a product to take to market that pretty much everybody that you know qualifies, right? Now, if they are within 100 to 400% of federal poverty line, they're going to get credits to help them offset the cost. That means, guys, national statistics, 87% of all families in the United States of America today that are using ACA to cover their family's healthcare needs, 87% of them pay less than $10 a month. That's huge, right? I have a lot of friends in network marketing. I said, what product do you have in network marketing that you can sell to a family for less than $10 a month in auto ship and make over $100 a month in residuals? It does not exist, right? That's why this is so sexy and so phenomenal, right? Paid per member per month. I want you to write those letters down, PM, because that's going to be the qualifying here for everything, right? Guys, this is a year-round opportunity. The SEP, special enrollment period, anybody that qualifies between 100 and 150% of the poverty line qualifies. Right now, you can write them up. If they just moved, they qualify for an SEP, family situation changes, they got a job, lost a job, kids move out, new kids are born. There's a lot of opportunities to write them up year round. If you ever get lost or stuck, feel free to reach out to your upline or directly to me. And by the way, guys, I'm the national trainer on this, so I can help you out no matter whose organization you're in. Reach out to me. You can reach me at 305-409-6835. 305-409-6835, right? Reach out to me and I'll be happy to help you, right? I don't recruit you guys, so don't call me that, hey, I don't like my upline, I want to go and put to you. That's not going to happen, right? We protect the hierarchies here. But what's important is that you understand you always got a lifeline. You got somebody that you can reach out to, as well as amazing leaders that are on this call and amazing leaders that will be watching the recording later on, okay? Now, our standard book of business is built through our annual election period, and that's November 1st through the 15th. It used to be a lot more important. Like I said, today, we have a lot of SEPs that you can get it done throughout the whole year, right? We're going to go into commissions here in a second, but I wanted to break this down for you. The carrier specific, it's carrier specific. We're going to go into the actual comp here in a second, but it's between $18 and $30, right? Per member per month. Average is 25. So I want you to write this down, 25 PM per member per month. So an example, 4-member household, mom, dad, and 2 kids. If the average 25 PM, you go in there tonight and you write that business, you're going to make 4 times 25, $100 a month pay raise. That pays you month after month after month after month after month, which is pretty cool. So I said, let's run your financial independence number, right? Every one of us, every single person on this call has a number that every month debt gets paid and the money goes out, right? What is your number? What is your financial independence? Now, I'm not talking about hunting lions in Africa or going to drink, French wine in France. And we'll get to that point. What is your initial number? And I want you to write that down. How much money? $1,000, $2,000, $5,000, $10,000? How much money needs to come into your house every month to pay off all your bills? Now, I want you to reverse engineer that. So if they average $25 PM, divide your FIN, your financial independence number, by 25. Let's say, that gives you a number. And then you divide that number by 4, because the average family has 4 members per household. And that tells you how many families you got to get out there and protect so you can become financially independent. And when I say financially dependent, meaning that you wake up on the first of the month and you know that enough money is coming in to cover all of your debts, right? That's the power of health insurance. That's the power of building a book of business with the health insurance side, right? Now, for those of you guys that are doing international, it's a little bit different than math. I'm not going to do that conversation today. We're going to have that conversation in the next couple of weeks where we have international health insurance, right? And we can do business all over the world. But today we're talking about Obamacare in the United States, right? So let's say you use the number of 10,000. That's the number I use, right? $10,000. Most people that I know with $10,000 a month in recurring residual passive income are okay. So if you get 10,000 and you divide it by 25, right? Let's do the math together, guys. 10,000 divided by 25. What's that number there? That's 400, right? That should give you 400. So you need 400 members a month to give you $10,000 a month in income. And if you divide that by 4, which is basically a house, household, you're 100 houses away from becoming financially dependent. And every time I talk about this, I always tell my people, listen, look at your phone. How many family members do you have on your phone? Everybody has at least 100, maybe 200, 300, right? People on your phone that have a family. And pretty much the whole United States, we can get this taken care of, right? So my goal is for you to fire your boss, right? That's my goal, is to put you in a position where you can fire your boss. I say this a couple of times, and I've had people like that bring their employees to op meetings. They're like, man, what do you mean fire your boss? I can't have her quit on me. I'm like, well, you got to pay her better then. All right, guys. So let's go into this. By the way, if you need this document, which is the ACA, the ACA compensation plan, just send me a text message. Again, 305-409-6835. Send me a text message with your email address, and I'll go ahead and send you an email with it, right? But let's go into the details of this compensation plan. So every carrier pays a little bit differently as far as the PMPM. Everybody pays a PMPM, okay? Everybody pays a per member per month. It's just a little bit different. So let's say, for example, you're in Florida and you sell the family with an Aetna program, right? If you're in Florida, Aetna, the first year, you're going to get paid $28 per member per month. And the second year, in the renewals, you're going to continue paying $28 per member per month, right? So what's a family of 4 pay you? What's a family of 4? What's it going to pay you on a monthly basis? This is the interactive part of the show for those of you guys who are live. If you're in Florida and you've got a family of 4, you just gave yourself a pay raise of $112 a month. You guys see that? Because it's 4 times 28. And that gets paid every single month. And that's with Aetna, right? We got Arizona, California, Texas, all of them with Aetna. See, Texas is 25. So if you're in Texas and you sell an Aetna plan, 25 times 4, you're looking at $100 a month. AvMed isn't only in Florida. That's $28 per member per month, okay? United Healthcare is a good company. I like it. And it pays in Florida $30 per member per month, and in Texas $25 per member per month. Okay, Michigan, it pays you $20, friend. It pays you $20 in Michigan per member per month. Okay, but it's a great program, solid, right? And again, I'm not going to talk too much today about the actual plans and stuff like that. I just wanted to go over compensation. But I want you to understand that if you write somebody in Michigan with this plan, you're making $20 per member per month. And then the following year, you're making $20 per member. It used to be that these numbers were different. More and more, you're seeing the numbers staying the same, right? But I highly recommend you get a Florida non-resident license because it's $30 in Florida, right? So you walk into that family in Florida, 4 members, you're making $120 a month pay raise, okay? Community health, that's in Texas, mostly around the Houston area. So if you guys are in Houston, you want to get definitely certified with Community Health Choice. Great company. Cigna is a national brand, right? And again, in Florida, it pays $27. In Texas, which is our 2 biggest markets, $25. We even have this one for Utah, right? Which I know we have some new members coming in from Utah. Georgia, $27. So this is a good program to sell in the different states, right? $27 per member per month. Again, 27 times 4 as an example. Let's do that math. 27 times 4. You're looking at $108 a month pay raise. So you walk into a family, and in 15 minutes, you do the whole thing. I'm not going to train on that part because I trained on that 2 weeks ago, and I'll train it again in the next couple of days. But if you walk into a family, you do a health Sherpa, you quote it out, and you close them on a Cigna, a family of 4, you just gave yourself $108 a month pay raise. Folks, I'm telling you, this is the easiest money you're ever going to make, especially the easiest residual money you're ever going to make. And if you work on it every week and you just keep adding families to your book of business every week, imagine you write 4 or 5 families a week throughout the whole year, right? You give yourself, let's say 4 families, that's $100 times 4 is $400 a week times 52 weeks, right? If you just did 4 families a week, 1 a night, 4 nights a week, right? You're at $20-something thousand easily. Okay. All right, let's look at Molina. Molina also has a Florida 20. Renewals in Florida for Molina's 21. I thought that was a typo, but it's actually not. In Texas, is 19 on the first year, and then renewals is $20, right? So they actually like incentivizing you to keep it on the books, right? I love Oscar. Oscar's pays $25. Oscar, I love Oscar. Florida right now is closed for Oscar, but Texas, you guys can still close Oscar. It's a real solid network, right? And again, you're looking at the initial in Texas at $25 and renewals at $25. Michigan's 20 and 20. So Michigan, on average, you're going to be about $20, okay, in Michigan. So you got to go after the big families. I would go like to the Catholic churches, to the Mormon churches, right? That's what I would spend time in, where people with big families congregate. That's what I would be doing if I was in Michigan. Actually, that's what I would do if I was anywhere in the United States. Those of you guys who are in Georgia and Colorado, Friday is your baby, guys. Friday is a phenomenal plan in Georgia. I sell a lot of Friday. My guys sell a lot of Friday in Georgia. Georgia is a really solid state for Friday, especially around the Metro Atlanta area. You're going to do very well there, and that's $27.50 per member per month. Okay, $27.50 per member per month. Ambetter is our favorite. It's our go-to. If you're in Florida, it's at $30 PM, which is awesome. But look how big the footprint is for Ambetter. You can do Alabama, Arkansas, Arizona, Florida, Georgia, Illinois, Indiana, Kansas, Kentucky, Louisiana, Mississippi, Michigan, Missouri, Nebraska, Nevada, New Hampshire, New Jersey, New Jersey, for those of you guys in New Jersey, right? New Mexico, North Carolina, Ohio, Oklahoma, Pennsylvania, South Carolina, Tennessee, Texas, Washington. This is our go-to carrier pretty much across the board. Those of you guys who were with us in open enrollment, we did what's called an NPN override. We're talking about bonuses in a second, but we focus a lot on this, and we read a lot of Ambetter. The bonus on Ambetter was $150, which is about to get paid next month, right? Because you need 3 months of the people paying for the bonuses to start kicking out. That's $150 per member in bonuses, right? Through Ambetter. You have to write over 150 members, right? But that was a lot of money. So there's some people on the team. I got one guy who did about 500. So calculate 500 times 150, like 75 grand. He's going to get a bonus next month with Ambetter. So get familiar with Ambetter as a product. That's what I have for me and my family. It's a real solid product, and it pays all across the country. So one of our biggest footprint products that we have. Okay. Now let's go into overrides and how to build a business, right? Some of you guys are here to produce and make some good money, and some of you guys are here to produce, make some good money. But in addition, you eventually want to start building a book of business, right? And building a book, an agency. So when you get to 1,000 members in your organization, 1,000 memberships, not agents, 1,000 lives in your organization, you become a GA here. Okay. When you hit 3,000, sorry, not sure what that's going on. When you hit 3,000, you become an MGA. Okay, when you hit and an MGA overrides GAs and overrides their open line agents, right? And then at 6,500, you become an SGA, and at 15,000, you become a partner. We're the only FMO that I know of that will pay out 100% of our PMPMs and our overrides. So we're going to go into that in a second. And I want to share with you guys what the philosophy of my partner, Tony Fejo, what his philosophy is. If I get Julius, and I said, Julius, you can only go to a level before me. That's the highest you'll ever go. What Julius is always going to hate on me, right? There's always going to be that man, I can't, my ceiling is not as high as your ceiling, right? But if I turn around and say, hey, Julius, let's get after this, brother. Let's build this together. And I want you to build this and become a partner here, right? Then you have an incentive to grow. But here's the beautiful part. If Julius' organization runs, right, and Andre's organization runs, and Andres Rene's organization runs, and France, everybody runs up, right, and we all hit partner, then collectively, we could sit at the table with Ambetter, we could sit at the table with United, right, and we say, okay, guys, we need some marketing dollars, or we need XYZ, here to help out, but collectively, we'll have 500,000, 1 million, 2 million customers, right? And then we become a cooperative real strong. That's why we kind of have a strategic alliance with, Experior and Avis and Bedrock Capital and all of you guys who running with different agencies and different IMOs, right? You're like, man, Mondo went crazy. Why would he do that? The reason why I do that is because I want to have an opportunity, and I want to have an opportunity to have you guys sit with me at these tables, right? And say, okay, Ambetter, we need $500,000 right now to run this campaign in Texas. And we have X amount of membership. You follow me, guys? That's why we're okay with giving away the farm. I know a lot of people criticize us, right? There's a lot of other companies out there that they do phony mathematics, but at the end of the day, we're the only FMO that you can come work with, that you can get to partner level with us, right? And that's what we really want you to do. I'm going to talk about MA in a second. That's Medicare Advantage. I'll talk to you guys about that in a second, as well as the dual program. Let me go into overrides. So when you become a GA, right? And these are the numbers that some people flip out. Like, what are you talking about? $2, right? Well, it's $2 on your entire organization override. So let's say you have 1,000 members in your organization, right? You become a GA. Now you pick up that $2. $2 times 1,000, that's $2,000 every month residual on somebody else's effort, right? Now watch what happens when you become a partner. That's $6. At $6, right? And you have, let's say 15, 20,000, let's call it 20,000 to use round numbers. If you have 20,000 members in your organization and you're at $6, right? And they're all open line to you, you're making $120,000 a month. Right, in Michigan, $120,000 a month, that could pay some bills, right? What about you guys in Texas? What about you guys in New Jersey, right? I know for Florida, $120,000 a month. I just came back from Miami. I was in Miami. That's my hometown this weekend. And, people are living it up down there, right? It's expensive to live in Miami. But with $120,000 a month, you're okay, right? You could live wherever you want. You could eat wherever you want. Eat from the left side of the menu. So, again, Oscar, Aetna, and UHC, those are our go-to products across the country, right? We do everybody else, but keep in mind, like Friday, for example, only has a $4 override, and Community Health $4 override, But again, I'll give you guys this document. I just wanted to show you guys the mechanics on how it works with ACA, okay? Affordable Care Act. I'm going to go ahead and pause the recording for a second and answer any questions that you guys may have here. I don't see any questions on the chat. All right. So let's go ahead and just keep it moving. Let's go ahead and keep it moving because I got to cover the Medicare Advantage. So Medicare Advantage, guys, just runs a little bit differently. In ACA, I love it because 100% of it is paid as earns, right? So there's no chargebacks. I hate chargebacks, right? In Medicare Advantage, it pays a little bit differently. So in Medicare Advantage, to become a GA, you need to have 5 members on your team that are ready to sell, and you have to have 200 memberships sold. That's how you become a GA in Medicare Advantage. Medicare is 65 and over. okay, for the most part, or people with disabilities. When you have 10 members on your team and you sell 300 memberships, you become an MGA. An SGA is at 25 agents on your team and 400 members, and then partner is with 50 agents on your team and 500 clients, right? That's how you go up, right? Now let's go into oh, sorry, yeah, we did have it over here. So that's how you grow in the Medicare Advantage arena, okay, in the Medicare arena. Now, how does it pay? It pays a little different because in Medicare Advantage, it pays upfronts, right? If it's new to Medicare, right? And what is new to Medicare? Either somebody who's turning 65, in the industry, we call it T65. If they're turning 65, or even if they're retiring after 65, because sometimes at 67, 68, people decide to work a bit longer, right? And once they retire, then they're new to Medicare, right? Or like I had a friend of mine, she had a stroke at age 31, 2 years after disability, they qualify for Medicare, okay? So in the United States, that's kind of like the typical new to Medicare. If it's new to Medicare, you get paid what's called initial, right? So in this year, 2023, it went up. It's now $601, okay? Nationally, if you're in Connecticut, PA, or DC, those are going to be $678. If you're in California or New Jersey, right? So if I was crazy enough to move right now, I would probably go to like New Jersey or California, $750. Puerto Rico, U.S. Islands, we don't really do much of that. And then PDP, which is just the prescription drugs, right? We don't really sell much of that. Now, that's only the first time that they go on Medicare. Every other time after that, whether it be through a special enrollment, through open enrollment, every year people like have a review of their plans and they could change plans. Any other time that is not new to Medicare, then you're going to get paid renewals, right? In 2023, the full renewal is $301 nationally. And then, as you can see, more money. However, this is paid in advance, but there is a caveat. In Medicare, it's prorated every month. So that $301, it's only $301 if you sell it during open enrollment with an effective date of 1/1. Okay? If you sell it in January with an effective date of February, it drops down to $276. If you sell it in March with an effective, in February with an effective date of March 1st, right? And by the way, in Medicare, you can sign it up on the last day of the month and it starts the next day. In ACA, the cutoff is the 15th. So from the 1st to the 15th, it starts the following month. If you write somebody on the 16th through the end of the month, it starts the following month after that. Okay. But in Medicare, you can literally sign somebody up on the 31st of March and there will be a 1st of April effective date. Okay. But it does get prorated nationally and it goes down every single month. So, but after that, it starts kicking in PMPM, right? Then after that, it peaks PMPM. And PMPM is whatever the number is up here, right? And every year it changes. Last year was 200 and change, and this year's 301. You divide that by 12, and that's the PMPM in the following year. Okay. Overrides, I'm not going to go into overrides today because we're restructuring it to make it better for you guys. I just wanted to show you guys what we have there. All right, and that's all she wrote. I'm going to stop the screen share. Going to go into some Q&A, and if there is no questions, whoo, got it down to 29 minutes. Mr. Julius, great.
Hey, Mr. Armando.
How are you, sir?
I'm fine. How are you?
Exhausted, man. Been traveling like crazy.
Hello, everybody. Yeah, my question is, you talked of ACA. You have to have is it FFM or something?
Yes, correct. For the ACA, you have
Yes.
to have your FFM, Federally Facilitated Marketplace Certification.
So how do we get that?
You should have received an email from contracting at powerhousefin.com with instructions.
I have written them an email, but they've not responded.
Okay, I will get with them. I know that we have everybody online for the commissions over the past few weeks, but I think they're working again on contracting. I will follow up with that, make sure that you get it. But the FFM here, hold on, let me get you the link for that. So, and if you can, Mr. Julius, go ahead and send them another email today. I will follow up with them with our daily meeting tomorrow morning. But go ahead and send them another email today, and I'll make sure that they get that FFM information over to you.
Okay. And then what about the Medicare certification too?
All right. So for those of you guys online live, I just put in the chat the FFM. You're going to go to info.healthsherpa.com/FFE-training. Okay. And that's going to take you to the site. So it's going to be info. So it's not www, guys. It's going to be info.healthsherpa.com/FFE-training. And that'll take you to the certification for FFM. For those of you guys who are looking to get your certification in Medicare, Medicare is a harder start because you have to do a thing called an AHIP, which is the certification, national certification. And then for each carrier, you're going to have to do a certification. I don't recommend you do what I did. I got certified with all the carriers. It took me like almost 2 months to do certifications. That's stupid. I didn't know any better. Nobody taught me any better. You really only need like 3 carriers. I would say Humana, which is Humana and Care Plus. Okay, that's together, depending on where state you're in, but that would be like the national one. And Devoted would be the second one, and United Healthcare would be the third. Those would be the top 3 carriers. And 4 would be WellCare, because WellCare pays very well, and it has a really good benefit package. But that's pretty much the 4 that I would say. So, Mr. Julius, if you're going to send a separate email, ask for Medicare certification, you're going to send that email to contracting@powerhousefin.com. I'll go ahead and put that in the chat as well today.
All right, I will.
And by the way, anybody who's new to the call today, I would recommend you go to send an email to contracting@powerhousefin.com. Ask for the form. They'll send you the form for you to get started. Get started with all the certification stuff like that, and that way you're registered in your system. It's going to ask you who's your upline, if you're going to want to do Medicare and stuff like that. So send an email to contracting@powerhousefin.com.
Hey, brother, got
Yes.
a question.
Yes, sir.
You did say the training will be coming up again the next few days. I know you had one last time. I connected to it. I was driving, and it's more of a hands-on. You should be in front of the computer kind of thing. So when are you having it again?
So every Monday at 1 p.m. Eastern, 12 for you guys in Texas Central. Every Monday at 1 o'clock, we do www.powerhouseempire.com. Every Monday at 12 noon Central, www.powerhousefin.com. 1 week we do ACA, 1 week we do Medicare, and I keep rotation through that. Next week is going to be a phenomenal training. We have Mina Marsano is going to come train on Sunfire, which is our quote and close software for Medicare. So I highly recommend those of you guys who want to do Medicare, send an email to contracting this week. I believe they're going to send you the information for Humana first, Mr. Julius. They're going to send you the information for Humana, because through Humana, you get like a $50 discount for the AHIP. AHIP, you do have to pay for it, okay? But through Humana, they'll give you a $50 discount, and then you can do your AHIP and then start a certification with them. Like I said, the top 4 carriers, again, there's a lot of carriers, and you can contract with everybody if you want to. We're not limiting you, right? But I'm just saying, from the practical standpoint of like being able to start writing business right away, you want to get Humana Care Plus, right? That's the first one. Devoted being our second one. WellCare and United Healthcare. Those are the 4 Medicare Advantage programs that we promote. United Healthcare is real strong with what's called DSNP, which is the dual enrollment. So if you got somebody who's on Medicaid and Medicare, that's a big, you want to get United Healthcare if you're in those communities, right? If you're in a community that people like to party, WellCare does Viagra as a standard issue, right? So like in the villages, we sell a lot of WellCare over there, right? And then down in the rest of the world, the rest of the country, we sell a lot of Humana and Devoted. Devoted, I love, they have a great customer service. So if you got a Medicare recipient that is on, one of these people that just likes to call you and ask you questions, you want to put them on Devoted because they have 1-800 Devoted. They can call there every day, 50 times a day, and ask all the questions they want, and they have a real good customer service plan at Devoted. I'll train on that next week, though. And then we are working on a website that will be password protected. So we'll have all of these trainings in that website. We're working on that right now. I just want to make sure that we protect the hierarchies and we don't cross lines and say something that we're not supposed to, because we have different hierarchies working with us. We have Experior, we have Avid Financial, we have Bedrock Capital, we have different companies that run. And again, we're not here to cross recruit each other. We're here to help each other build and together get to be a real big powerhouse company. Any other questions, comments, or concerns today? All right, guys, I'm fired up. Again, my name is Armando Torres, Armando. Last name is Torres, Torres. You can reach me at 305-409-6835. That's the best way to reach me there is through WhatsApp or text messages, right? Because I travel a lot. I was on the road all weekend. I'm going to be here the 2 days, and then I'll be on the road again. But here's the other thing is contracting at powerhousefin.com. Contracting at powerhousefin.com. Send them an email, ask for the registration link. They will send you the registration link. You'll fill it out, and they'll help you with all the contracting and stuff like that. Julius, I will definitely get up on them, make sure that they send you all the stuff that they need to send you right away. All right. All right, guys, you guys have a wonderful week. Let's go write some business. Let's go build your book of business, and let's get you to fire your boss. Have a good week. Talk to you later, guys.
Take care, brother.
Thank you.